Welcome to this explainer. I'm so glad you're joining us today because we're tackling a topic that touches almost every single one of us in some way, yet it remains vastly misunderstood. Today, we're taking a hammer to the deeply rooted, harmful stereotypes about addiction. And these aren't just innocent misconceptions. The shame and social disapproval around addiction are actually greater than for any other medical illness. It's wild. This stigma literally costs lives because it keeps people from getting the help they desperately need. So we're going to look closely at what the science actually says and break it all down clearly and logically. Let's just dive right in.
I want to challenge you right out of the gate here. What if almost everything you know about addiction is actually wrong? Think about it. Most of what we think we know doesn't really come from science or medical professionals. It comes from movies, TV shows, and unhelpful societal stigma. We've basically been fed a narrative that's built entirely on discrimination and stereotypes. So today, we're going to completely reset our understanding by looking at the hard facts.
And to understand why this reset is so absolutely crucial, just look at this number: 46 million. Right now, 46 million Americans are struggling with addiction. It is the third largest cause of death in the United States. We are looking at a public health crisis of epic proportions. Yet so many folks suffer in total silence because of the exact stereotypes we just mentioned. This is not some fringe issue. It's a massive, central pillar of our society's health landscape.
Okay, let's get right into theme one, the brain versus the character.
Probably the most common myth out there tells us that only certain kinds of people get addicted. But the reality? Addiction can happen to absolutely anyone. It has zero to do with race, your upbringing, your personality type, or your high school GPA. People with incredibly stable jobs, people who wait until after 5 p.m. to have a glass of wine, or who come from amazingly loving families, they are all vulnerable. But because of the stigma, so many people are forced to hide the severity of their struggle.
Which brings us to a huge one, the idea that addiction is just a choice and that people should just say no or use sheer willpower to stop. The reality is that addiction is a consequence of a complex mix of genetics, trauma, upbringing, and environment. No one chooses how their brain is going to react to substances any more than someone would choose to get cancer. Just saying no is a completely ineffective prevention strategy because it totally ignores the complex reality of how addiction actually develops.
So, why isn't willpower enough? Well, let's look at the biology. When a substance is introduced, it shortcuts the brain's natural effort and delay process. It just floods the brain with pleasure chemicals. And this fundamentally alters your brain's natural reward pathway. The circuits that are linked to our very survival basically get hijacked. Ultimately, these profound physical changes erode self-control, and they send highly intense impulses to take drugs. These impulses become no different from the powerful, primal urge to eat food or drink water. This biological hijacking perfectly explains the compulsive behavior we see in addiction.
Because addiction is often treated with behavioral therapies like counseling, this myth popped up that it's just a behavioral problem and not a real medical disease. But here's the thing. Human behavior begins in the brain. Advanced brain studies show that treatments, both psychotherapy and medication, actually change brain function. So the fact that behavioral treatments are incredibly effective does not mean addiction isn't a very real, very physical medical illness. It absolutely is.
And before we leave the science of the substance itself, we really have to highlight a surprising misconception. Legally prescribed medications from a doctor can be just as highly addictive as street drugs. Medications like painkillers, sedatives, and stimulants pose a severe and growing addiction risk across all age groups. Just because a physician prescribed it doesn't magically remove the biological risk it poses to your brain's reward pathways.
All right, moving on to theme two, the family dynamic.
The most common piece of really bad advice that families receive is the myth of tough love. Distressed parents are constantly told to kick their loved ones out, cut them off, just completely detach. But compassionate, kind approaches are actually so much more effective. Tough love tactics usually just lead the unwell person to feel deeply rejected, unworthy, and hopeless. It's love and support, not cruel punishment, that actually encourage someone to change.
Instead of cutting someone off, families can use empowering, evidence-based strategies. First things first, it starts with practicing self-care, so you are in a healthy place to actually help. Next, you can learn to change your interactions and develop positive communication and reinforcement strategies. And finally, help them reconnect to healthy activities and relationships. People struggling with addiction often become entirely disconnected from a healthy life. So helping them bridge that gap can be completely pivotal in motivating them to accept help.
Now, if you're a family member, you might be thinking about the word enabling.
The fear of enabling often paralyzes people from providing that crucial support, and tied directly to this fear is the concept of codependency. Well, let's relieve some guilt right now. Codependency is an unscientific theory popularized back in the 1980s that unfairly blames loved ones who are just trying to help. It carries so much baggage and basically stigmatizes caring for someone who is unwell. Listen, there is absolutely nothing wrong with loving and wanting the best for a struggling family member.
And this leads us directly to one of the most dangerous myths of all, the idea that people have to hit rock bottom before they can get well. The reality here is stark. Waiting can have deadly consequences. Seeking help early means the person has far more resources to draw upon to help them recover, like a supportive family or a job they're still active in. The sooner someone gets help, the better their chances are. Please, never wait for a mythical rock bottom.
Let's move to our final section. Theme 3, the reality of recovery.
A lot of people buy into the myth that going to treatment once will just completely fix the problem, like a magic wand, but the reality is that treatment is a long-term commitment. One single visit to a treatment center is often just the very beginning of a long journey. Getting well involves changing deeply embedded behaviors, and that requires time, effort, learning lifelong coping skills, and yeah, sometimes more than one treatment visit to really get on a stable path.
Part of that long-term commitment often involves MAT, which stands for Medications for Addiction Treatment. There's this huge stigma out there that using MAT is just replacing one addiction with another. In reality, these are life-saving medications. They ease withdrawal symptoms, give people the biological breathing room they need to recover, and prevent fatal overdoses. Crucially, they do not create a high or cause impairment. These medications safely allow patients to go to work, drive, care for their families, and live completely full, normal lives.
So, what happens if there's a setback? The myth says that if someone relapses, previous treatments failed, and they are just a lost cause. We need to completely reframe this. The reality is that a relapse is simply a recurrence of symptoms. It does not magically erase all the progress that was made. A recurrence merely signals that the current treatment approach or support system might need an adjustment. It is a completely normal part of treating a chronic condition.
This is brilliantly illustrated when you compare addiction to type 2 diabetes or hypertension. The management for all three of these is lifelong. And crucially, the relapse probability for addiction is practically identical to these other standard chronic illnesses. We don't view a diabetic needing an insulin adjustment as a lost cause, right? We must apply that exact same scientific standard and compassion to addiction. Because we misunderstand the nature of relapse, we often fall into the trap of thinking that people with addiction are just hopeless. I want to pivot to a profoundly uplifting message right now. The reality is that millions of Americans are thriving in recovery right this second. People recover from addiction every single day. The real tragedy is just that we don't hear their incredible stories as often because the lingering societal stigma forces them to keep their success quiet.
I want to conclude this explainer by leaving you with a beautifully hopeful thought. With the right treatment, recovery is possible for everyone. Once treatment begins, individuals can absolutely manage this illness just as they would any other chronic condition. So I leave you with this question to chew on. Now that you know the facts, how will you use this science to change the way you talk about addiction today? Thank you so much for joining me in breaking down these stigmas, and I really hope you walk away feeling empowered with this knowledge.